Afternoon, everyone. Thanks for attending our Lunch and Learn. I hope you took a bite out of your sandwich before we get started here. One of the things I just want to point out to you with Friend Health, again, today is our oral hygiene and how it can benefit your overall health. That's what the presentation is all about today. We have two wonderful speakers who is going to provide us with information that we can use. A lot of the information I believe we all should act upon as they explain things to us, okay? Just some housekeeping rules for everyone that's on the line. Stay muted for people who are involved and have questions. Send those questions through the chat. Please try not to write on your screen or anything of that nature. And we will begin to get started. Now, I just want to let you guys know those two things. Stay muted. And of course, send your questions to the chat. Okay, let's get started. Tony, next. All right. Okay. Friend Health Clinic. All patients are welcome to Friend Health, regardless of their ability to pay. We accept Medicaid, Medicare, as well as commercial insurance. We also offer a sliding fee scale discount program for uninsured or underinsured patients. Eligibility in that case is based on household size and annual income. Next. We have several services that we provide here. I'll just point out a couple of them that are major to me. The adult medicine, of course, dental services, psychiatric services, pediatrics. We have social services as well. And we also provide health insurance enrollment, in particular Medicaid in most cases. So those are just some of these items or services that we provide. We have a list like this that you can look at. If you need more information, you can just contact us and we'll get it to you. Next. Okay. So with our dental program, again, we have a couple of locations, one at 5635 South Pulaski and one at 5843 Southwestern. As you can see here are some of the services they provide: exams, x-rays, cleanings, fluoride, oral health, education, extractions, etc. Right? So please contact us through our appointment number. And also at the end, I'm going to provide you with a couple of other numbers. If you can't get in that way, there are two people that you can contact that can assist you with that. Next. Okay, here are our locations for those who are not aware. This is our new number too, by the way. Let me point that out for Friend Health. So if you're calling in to schedule appointments or for any of your normal requests from the clinic, you do use our new number, 312-682-6110, okay? So in terms of scheduling your appointments, that's the number to call. Again, I'm going to provide you with another number toward the end of my part. Here are our locations. Again, I just want to emphasize the dental locations, which is the 5635 South Pulaski and 5843 Southwestern. Those are where we have our dental offices. Next. Okay. Also, we provide behavioral health services, integrated healthcare services from Friend Health. Next. All right. Integrated health teams provide active referrals for services that may be a result of substance use or misuse, anxiety, sadness, and other behavioral concerns as well. Next. Okay, we have our HRDI is our subsidiary of Friend Health. We've merged with them over 2.5 years ago. The services are integrated and interactive. They have locations at 200 East 115th Street. This is the direct phone number that you can call if you have a concern or you just want to talk to someone or to schedule an appointment with them, or if there's an emergency situations. This is the number that you can call to get into HRDI so they can assist you with whatever your concerns are, okay? And this is the information that you should bring with you, state ID. We accept all insurances, don't worry about it. And the number is open 24 hours, or the number is available 24 hours, 7 days a week. Next. Okay, they have a group of services that they provide. I'll just kind of touch on some of them. HRDI provides 13 individual programs and services addressing, but not limited to, the following issues: anxiety, substance use, conduct disorders, medication management, other serious mental illnesses, housing, and support for health. If you are a loved one, if you can that number down to me. If you or a loved one has some concerns or has someone in your family that you want to assist and help, You can call the number that I talked about earlier, again, 312-441-9009, 24 hours, 7 days a week. Next. Here are some of their locations and what they actually provide. Roseland, the 20 East 115th Street, that's like your major intake and assessment spot, right? Medication assisted treatment, those who know what that is, they'll know exactly what I'm talking about. That number is at the address there is 340 East 51st Street. There's the number, the same number, and those are the hours. We also have a recreational recovery drop-in center at 1757 East 75th Street for peer support. We have family case management, which addresses infant concerns and health issues, right? So that's at 8151 Southwestern. Next. Okay, now in terms of insurance, we pretty much accept all insurances. Let me state this to everyone. We are a federally qualified health center, which means that we accept all comers. Anyone who comes to our doors, we are in a position to help them, right? Regardless of whether they have insurance, a job, whether they're homeless or not, we can assist them with health services. That is our vision and our mission with our company, to assist those in underserved communities or people who don't have the access that they need to have. Let me just give you a little bit more on that last piece here. If you don't have health insurance of any type, we do have the sliding scale programs. If you are interested in, once you come to the clinic, here are some of the information that you need to bring with you: a photo identification, proof of income, proof of address. If you don't have any income, just tell them that. Basically, the sliding scale is based upon income and family size. So just to let you know how that works. Next. All right, now here's the important part. Here are two people that you can contact to assist you with getting appointments, helping you guide through the clinical services that we had, ask additional questions that you may not have been able to get answered here. If we don't know the answer, we will lead you to the proper person in order for you to get the answers and the services and the help that you need. My name is Conrad Gilbert. I am the Outreach Community Engagement Director. My telephone number is 312-863-0660. And we also have Mr. James Corbett, who is a coordinator for outreach services. His address is 5843 Southwestern. His telephone number is 312-989-5995. So on to today's presentation for oral hygiene and dental health, and how your dental health and how it can affect your health. We're going to have Dr. Parikh, who is going to provide us with a presentation to give you some information that you need. Again, utilize the chat for questions. We'll address as many questions as we can after the presentation. All right, thank you very much. Go ahead, Doctor.
Thanks, Conrad. Yes, again, my name is Neil Parikh. I'm the dental director here at Front Health, and along with me is Dr. Lisa Kendall, our dental hygienist. We both started here 3.5 years ago at the inception of the dental program here at Front Health. So if you guys have any questions, yeah, feel free to put it in the chat, and we'll do our best to answer it at the end of the presentation. Okay, so we're going to go over several important topics: the importance of oral health, the prevalence of disease, the terminology, and prevention, and some resources and key takeaways. Why is oral health important? So oral health is connected to one's general health. Believe it or not, studies show that oral health is linked to systemic diseases like cardiovascular disease and diabetes. The mouth is a gateway to the body. Teeth and saliva begin the first steps to digestion and getting vital nutrients. Teeth also help us to speak and smile, and can directly impact one's physical and mental well-being. You know, so many times we get patients saying that, you know, they like to get their smile looking a lot nicer for a job interview, such as. So those things are very, very important. So here's some important points about the prevalence of oral disease. So the first one, dental decay or dental caries, as we call it, is chronic but can be prevented with proper oral hygiene and taking control of one's health. Dental caries or dental cavities are the most common chronic disease of childhood, 5 times more common than asthma. We also, when we have a new patient come in, we will also do an oral cancer screening check. And in the United States, it's reported that about 50,000 cases of oral cancer are diagnosed each year by dentists and dental hygienists. Periodontitis or gum disease affects almost 50% of our adults. And in population, the communities where I think it's even higher. Periodontal disease is when eventually teeth start to feel loose as we get older and eventually fall out, and that can be prevented. Along with periodontitis, tooth decay can also be prevented. Good oral hygiene, including brushing twice a day, flossing, and proper nutrition are key in preventing dental decay. Okay, so this is what we see when we're taking x-rays and looking in the mouth. This is a cutout of what the anatomy of a tooth is. So everyone's, of course, familiar with the crown portion, which is what we see of the tooth, and also the enamel. Enamel is the white portion of the layer, white portion of the tooth. And on average, children have 20 primary or baby teeth, and that goes into 32 adult permanent teeth. So the first layer, the enamel layer, is the protective coating for the tooth. And believe it or not, enamel is the hardest substance found in the body. Going to the second layer, which is in the middle, the yellow layer, is the dentin layer, and that is the secondary, somewhat protective layer of the tooth. And then the third layer, which is when we start seeing patients that come in with symptoms, tooth pain. A lot of times, the middle layer, which is the pulp or the nerve of the tooth, is exposed. And that's when patients start getting pain. And the pulp or the nerve in the middle is what supplies the tooth with nutrients and everything that it needs to stay strong and allow us to chew. So what are cavities, right? We hear cavities maybe on TV, you hear from your own experience, but tooth decay, which is also known as cavities or dental caries, is the result of a process that can leave a hole or a cavity in the mouth. Our mouth is full of naturally occurring bacteria, but tooth decay begins when the bacteria feeds on sugars, such as carbohydrates, or of course sugars from candy, anything that produces sugar. And the point is that when we start brushing twice a day, it's to break up that cycle. It's to break up the cycle of the naturally occurring bacteria that's in our mouth that's occurring with what we eat and drink throughout the day. The refined sugar, which is found in candy, crackers, soda, makes it easier and faster for bacteria to break down that sugar. So, and that's where, eating an apple, which contains sugar, is much better than eating a candy bar that contains the same kind of sugar, because the candy bar contains sugar, which is much more easily metabolized or digested by this bacteria. Cavities can occur on any part of the tooth. We see it everywhere, and depending on the location and different factors, amount of saliva, things like that, cavities can occur on different parts of the tooth. And luckily, there are ways that we can slow the process down with, our saliva, and the enamel in the beginning stages of cavities, it can actually repair itself. So the point is, going to see the dentist is very, very important to get your regular checkups. So a lot of these problems can be found when they're early on. here's some pictures of what tooth decay looks like when we're looking at it in the mouth. You know, these are just a couple examples of what we see. We, you know, start seeing these dark shadows on the teeth. We use certain instruments to check to see if the tooth is soft underneath there. X-rays. X-rays are very, very important in finding things that our eyes cannot see, right? So that's when, you know, dentists and dental hygienists will take X-rays to see what's going on underneath the tooth. So this is a good illustration of how cavities start and what it can progress to. So when we start seeing, you know, the dark circle at the top left corner of the first picture, that's the cavity starting. It starts off small and eventually keeps progressing as it gets towards the middle of the tooth. And once it gets into the nerve or the pulp, what we call, that's when patients typically will start experiencing dental pain, tooth pain. And untreated cavities can cause pain and or swelling. When the pains are long enough, the body reacts by sometimes producing what we call an abscess or a swelling. And, you know, we see it often enough, and, you know, our recommendation to a patient after they've had a tooth extracted is to make sure you get a full exam and get ahead of the game instead of always coming in when you have tooth pain, because by then it's typically, many times it's too late to save that tooth. So again, dental infections, depending on how long it's been around, can be serious and life-threatening if it's not treated, especially when it gets to the abscess stage. The infection can produce symptoms such as facial swelling, which can block airways, things like that. Having regular dental checkups and treatment if necessary can help from potential problems in the mouth from getting worse. Risk factors. The risk factors are very important. So frequent snacking between meals can cause an uprise in dental decay. And the way to think about it is that every time we're eating, you know, a granola bar or a candy bar or anything in between our meals, we're giving more fuel to the bacteria. And in some cases, there's some risk factors associated with medications that you may take. So while patients taking medication for treating their cholesterol or the diabetes that's causing their saliva, the amount of saliva in their mouth to decrease. Saliva is a natural lubricant, and it also helps cleanse the teeth naturally. That's what our tongue helps us do. So a lot of times medication, it may not be even the patient could have perfect oral hygiene, but they have a lack of saliva, and that needs to be addressed with artificial means or adjusting medication. And so, you know, symptoms that some of you may have already had, you know, swelling of the face and the mouth, redness around the mouth, pain, bad taste. Those are common symptoms of dental decay or gum disease, which is going to be our next topic in just a moment. So preventing tooth decay. So there are ways to help prevent tooth decay. First one is fluoride. So having regular dental checkups, fluoridation, it's in our water, in tap water. It's also a treatment that we provide in the office, which is basically just like a paste that we put on patients' tooth after they're cleaning, and that helps prevent cavities. There's also ways making sure that when we're brushing twice a day, most toothpastes do contain fluoride, and fluoride is, like I said, a naturally occurring mineral that helps prevent cavities. The other one that we do typically with our pediatric population are dental sealants. Dental sealants are basically like, it looks like a tooth-colored filling that we put on the back teeth that helps prevent cavities in our pediatric population. I'm going to stop right here and see if there are any questions before we get into periodontal disease or gum disease. I don't see any questions right now, but feel free to ask at the end of the presentation. I'm going to introduce Lisa Kendall here. She's, again, our dental hygienist here at Friend Health.
Hi, my name is Tanya. I have a question.
Sure.
I, a couple years ago, started the process of getting braces, and I have braces, but during the pandemic, I lost my job and I no longer have that insurance. I now have county care. And I was wondering, do you guys have any orthodontists that you work with or anything that I could possibly pay cash, like on a sliding scale or something, to try to get the process completed with my teeth?
Okay, so I would recommend making an appointment with us so we can make sure that first thing, it's a good question about braces. Braces are great for straightening teeth, but we got to make sure that cavity free and gum disease free before braces are pursued.
Yeah, I actually have some dental issues. So yeah, I would definitely be making an appointment. And then if you guys could refer me to someone else to finish the orthodontic portion, I'd be really grateful. So I'll make that appointment. Thank you.
Sure. Thank you.
By the way, thank you very much, ma'am. Remember, guys, use the chat for your questions, okay? That way he can keep moving on the presentation. Go ahead, Dr. Free.
All right, so I got Lisa here, and she's going to start talking about gum disease and everything gum related. Thank you.
So good afternoon, everyone. Thank you for joining Friend Health. We are, again, excited to have you here, and thank you for joining the Zoom meeting. So I am the dental hygienist. I'm the registered dental hygienist. I've been with Friend Health for 3.5 years, respectfully. We started the program back in March of 2018, I believe. So we're going to talk about gum disease. So there are several types of gum disease, starting with, you probably know it as gingivitis, or if your gums are red and inflamed. And so the first slide we'll talk about what is plaque. How do you accumulate plaque, and what is plaque? If everyone can just take their tongue and just go across their teeth, that sticky, or if you feel a pasty or sticky film that's on your teeth, that's what plaque is. Plaque is that it's colorless. It contains bacteria that can also form around the teeth and the gums, and they get red and inflamed. Over time, plaque builds up, and it can turn to calculus. It gets really hard on the teeth. And in turn, it could sometimes result and goes from gingivitis to periodontitis if left untreated, and also may result in cavities and irritation, again, of the gums. Next slide. Next slide, Dr. Neal. Okay, and if you can look here on the pictures here, the picture on my left, you can see this area that's where the gums are like all puffy and red around the area where the tooth is. The tooth and the gums meet. You can see the white surface, the sticky stuff, that's all plaque. You can see the yellow area where the teeth are not being brushed properly or daily. That's what will accumulate. And plaque accumulates like right after you brush. It can start accumulating like 12 hours after you even get your teeth clean. And that's point in case why we ask you to brush twice a day, 2 to 3 times a day. The slide on the right is where the calculus has been sitting for, the plaque has been sitting for a while. It has not been removed, and it turns to calculus, or in layman's terms, we would say tartar on the teeth. It looks like a brick, I guess you would call it. And you can only remove that when you come to the dentist. When you come to the dentist to get a, I'm sorry, my phone is ringing here. I don't know. Sorry. Okay, sorry about that. I had an incoming call through the computer. But you can get you can only have this tartar removed when you come to the dentist to have a cleaning. You cannot remove this on your own. Once the plaque has sat there and gotten hard, it will not be able to be removed by your own hands. So there's different types of oral disease. You have the first stage of which is gingivitis. We went over that a little bit, the inflammation of the gums being red and swollen. The gums will easily bleed. And that's caused by plaque. Sometimes it could be hormonal if you're pregnant or you have some hormonal changes going on. You can get what we call pregnancy gingivitis, or you can have inflammation due to some chronic disease in the body. The next stage is periodontitis. This is a chronic gum disease that may lead to permanent bone loss. If you notice that some people may have lost teeth and they say, oh, my teeth are loose. Well, that's because the bacteria that caused gum disease has now progressed, and now it's getting underneath the gums, and it's damaging the bone and the tissues around the tooth, which can cause mobility and then tooth loss. Substance abuse is another cause of gum disease. Severe alcohol, drug usage can damage the mouth. It can also increase the risk of certain oral cancers and also permanent tooth loss. And Dr. Neal touched on gum disease and oral cancer. It's important for us to check if we have any sores in our mouth, something that will not heal. Come to the dentist, let us see what it is. If we cannot recognize or diagnose, we will send you to an oral surgeon or an oral pathologist to see if that's cancer. So they say that oral cancer is the dental team's cancer that we should be looking out for. Very prevalent. And I have myself found oral cancer in several patients. So next step, Dr. Neal. The next slide, please. So 5 steps of prevention of gum disease again is brushing twice a day, morning and at night. The night brush is very important because you eat all day, you're snacking, and you just don't want to go to sleep with that bacteria in your mouth, because if it's in your mouth, it can harvest other bacteria and it can lead to gum disease. Flossing at least once a day before bedtime is what we recommend. However, some people can't floss before bedtime. I would recommend keeping the floss where your toothbrush is, so it's visible and you can remember to floss. Anything you do for more than 30 days, they said it becomes habit. And once you start flossing, your teeth will not feel clean if you're not flossing. Choose a fluoridated toothpaste, mouthwash. You want to drink tap water because it does have fluoride in it. And we are noticing that more adults are coming in with cavities because they're drinking bottled water, which does not contain, a lot of it does not contain fluoride. So if you're going to drink bottled water, look for the ingredients and see if you can find ones with fluoride in them. Eat healthy meals. Of course, limit the sugary foods and choose, water. Drink plenty more water than you do anything else. You sometimes too, you have to be careful even with kids drinking Gatorades or vitamin water, and just look at the contents, look at the nutrition ingredients and make sure it does not have sugar. And also very important to see your dentist twice a year, come for your checkups, do your best to keep your dental appointments because it is very necessary to your dental health. So just make an appointment. We look forward to seeing you guys here at Friend Health. And then we're going to go to the next slide. And of course, it's our favorite candy time of the year. Who doesn't love candy, right? I love candy too. So just your dental health guide for the Halloween. We do, as dentists, give out more candy. They say that 76% of dentists give out Halloween candy. I personally don't give out sweets, but we do give out suckers without sugar here at Friend Health. So that's it. That's all I have. If you have any questions, please feel free to chime in.
Is there a lot of plaque built up on your tongue?
So you can get plaque buildup on your tongue. So you want to brush your tongue for 30 seconds. Brush your tongue with your toothbrush. If you come in for a checkup, we also give out tongue scrapers, or you can get one from your local drugstore.
All right, thank you.
Good question.
What did you say about flossing and your teeth not being able to stay white? Did you, or?
Well, I said, well, with the flossing, I said the flossing is for the number one reason for flossing is because the floss goes where the toothbrush doesn't. When you're flossing your teeth, you're going in between your teeth. If you're using a toothbrush, it goes on the out, it goes across the tooth, but it doesn't necessarily get in between the teeth. We find a lot of, we call them incipient lesions, which are in between the teeth. So little cavities start in between the teeth where food plaque is allowed to sit there.
But maybe I misunderstood. I thought you were saying your teeth can never fully be, maybe you were just saying they can't fully be clean without flossing. It didn't have anything to do with whiteness though, right?
No, whitening is a whole different thing. Whitening, you can have your teeth whiten with a like peroxide agent. We have we don't do whitening here per se at Friend Health. We don't do teeth whitening, but that's we can talk about it when you come in for your exam. We can talk about ways to have your teeth white.
Okay, because I was going to ask you, what do you think of those strips and the gels and I just learned about something called, it's called Santa White. It's supposed to be this full mouth toothbrush. Mm-hmm. Have you ever had of that? Because it sounds interesting, but I was like, I don't know, for $50.
Yeah, it's like, is it like a tray or something? I've never heard of it, but if it's a tray or have you been here for an exam and checkup?
No, I put in the chat, how do I check with my insurance to make sure, because I have a dental insurance and I need to make sure y'all are in it.
The network, you're saying?
Right.
Yeah, you would, you can definitely call your insurance and check with that. But again, whitening is subjective. It's something that if I think personally, you can try to crest white strips and see if that will get your teeth where you're whitening, how white you want to go. You don't want to just continue to use a whitening product though, can you? Because it does cause sensitivity if you're not doing it properly. And
so in terms of the insurance, do I just ask them to check Friend Health, that name, or Friend Health Dental, or what do I?
I don't know. That question I have no idea, because you may have to go under Friend Health Dental or our dentist. I don't think we're in network with you can contact, I'll give you a number to contact here. Okay, cool. 312 863 0660.
312-863 what?
660.
0660. Thank you.
Yes, you're welcome. Okay, so we have 5 takeaways from Doc. Okay, Doc, I'm going to turn it back over to you.
Okay, thank you, Darlisa. And yeah, so 5 takeaways of oral health. Oral health is connected to your general health. It can affect all parts of our quality of life: physical, social, mental well-being. Tooth decay is preventable with proper oral hygiene and dental education. Prevention is also the key in finding things when they're smaller, rather than coming in when we have a toothache. Okay, and that's very, very important. And I stress that to all the patients that I see for what we call an emergency exam, is that the next time I see you should be for when you're not in pain, right? It's obviously much easier on the patient and us. So providing oral health resources, there's plenty of oral health resources as far as the ADA.org, American Dental Association. There's a lot of education on there, a lot of resources on there. So I would highly recommend going to ADA.org.